Welcome to the lecture on Child Psychology Part 2. I am Dr. Fawaz Siddiqui from Department of Pediatric Dentistry. This lecture is the second in the series of 3 lecture series on child psychology. So let's see what we are going to learn in this lecture. Like we had seen in the earlier part of Child Psychology 1, this is what we will learn. In the earlier section, we have learned a few theories, and in this session, we will learn the 2 other remaining theories on emotional and cognitive development. So these are the learning objectives, which is similar to the ones that we had in the child psychology part 1. So to quickly recapitulate on what we learned in the first part of child psychology, we looked at the uh, science of psychology, where we learned that psychology is to understand the way people think, to look at their mental processes, how they think, and then of course how they behave. And we looked at the goals of psychology, where we had 4 goals of psychology, beginning from describing a behavior to the fourth goal, where we are introducing some intervention to control the behavior, because now we have learned how the behavior functions, or we have an explanation for the behavior, so we are able to put in the appropriate interventions to control behavior. Then we also looked at the application of science of psychology in general. There were a lot of subheadings, subtopics, or specialities in the science of psychology, but our interest is in the theories of child psychology, and we are learning this theories of child psychology in order to put in some behavior management um, tools for children, so that we can control their behavior in the dental clinics. So we need to know how children think and how they behave according to their age. To understand that, we looked at the 3 theories on learning and development of behavior: the theory of classical conditioning, the theory of operant conditioning, and we also looked at the theory of observational learning. So these theories were basically uh, based on how children behave, or how children learn how to behave. Okay, and these theories can more or less control the way children can behave in the clinic. So in today's lecture, we are going to look at the remaining 2 theories on child psychology. So let's see which are those. So the remaining 2 theories are theories of cognitive and emotional development, and these theories are basically based on the fundamentals that each child develops from infancy to adulthood and undergoes some personality changes, and these personality changes are brought about by his psychological development, and this psychological development is influenced by the social surrounding, or the social circumstances, or the society that the person lives in, how the personality develops into. So there are basically 3 very famous theories of psychoanalytical theories. Uh, First is psychosexual theory, given by Dr. Sigmund Freud, then psychosocial theory, given by Dr. Erik Erikson, and then the theory of cognitive development by Jean Piaget. So we're going to look at the 2 theories by Dr. Erik Erikson and Dr. Jean Piaget, and we're not going to go into the details of the theories of given by Sigmund Freud, and maybe we'll look at it when I give you an assignment to do on the theory of psychosexual development. So for us, more uh, theories of dental applications are by Erik Erikson and Jean Piaget. So let's begin with the first theory. So the psychosocial theory was given by Dr. Erik Erikson in 1963, and he was a psychoanalyst. And this theory is also called as model of personality development, where he tried to explain that the personality develops in a predetermined order, and the personality development has to go through 8 stages from infancy to adulthood. And Dr. Erik Erikson said that at each stage, the person faces a kind of a social, psychosocial crisis, which defines how the person's personality will develop. And if the psychosocial crisis is successfully resolved, the person goes ahead into the next stage of psychosocial development, and then he ultimately completes all the stages. So let's see what are those 8 stages in a nutshell. So the picture that is there on your screen is the stages of psychosocial development. If you can see, it all begins with infancy, early childhood, preschool, school age, adolescence, young adulthood, middle adulthood, and maturity. And what you see below these are the psychosocial crises. Okay, so like I said before, these crises are of psychosocial nature because they involve psychological needs of the individual conflicting with the needs of the society. That is why psychosocial. And successful resolution to this crisis results in completion of the stage for a healthy personality and progression to the next stage. And obviously, if you fail to resolve the psychosocial crisis, it will lead to inability to complete that stage, lack of progress to the future stage, and these future stages, and then we can have some disorders of personality. And one thing to remember here is that these stages can be resolved successfully at a later stage. So you may find that people uh, may be lagging behind in their progress. Okay, so more or less they are progressing, but they may not be progressing as their peers. So there will be some delay in the progress, but ultimately everybody gets to the end. Okay, so we must remember that Dr. Erik Erikson did all this by observation, and I would say 95% of the population will fall into this kind of theory to explain personality development. There will be some 5% population on which these theories may not be applicable. So for us, we need to understand that majority of the population will follow this theory. So this diagram is again a bird's eye view of the theory. And if you see, beginning from the left, you have first stage of infancy. Okay, and during this first stage of infancy, the question that the individual asks is, can I trust the world? Okay, and the social crisis is the trust versus mistrust. Then the stage comes of childhood, where the individual asks, is it okay to be me? And therefore you have a crisis of autonomy versus shame and doubt. So once you clear that, you go to progress to the next one. In your preschool age, the question that the individual asks is it okay for me to act, to do something? And the crisis here is initiative versus guilt. And if you successfully progress, go ahead further, you come to your school stage of school, and the question the individual asks is, can I make it in the world of people or things? So here the crisis is between being industrious and or being inferior. After that, we have the stage of adolescence, and this is the question they ask. The individual asks, who is in the stage of adolescence, who am I? Who can I be? And this leads to the crisis of identity versus role confusion. On successful completion of adolescence, you come to the stage of early adult, and here the question the individual asks is, can I love? And therefore you will have a crisis of intimacy or isolation. So again, successful completion of early adulthood will take you to the middle adulthood, where the question the individual asked is, can I make my life count? Is my life worth it? And here you will have the crisis of generativity versus stagnation. And once you successfully cross that, you come to the stage of late adulthood or maturity. And the question the individual at this stage asks is it okay to have been me, right? So is it okay to uh, have been me? Is it okay to be me? Okay, and here we have the crisis of ego integrity versus despair. So in the following lectures, we're going to look at into the individual stages, and then we're going to look at how we can use this theory to uh, intervene with the child's behavior in the dental clinic so that he can be prompted, or he can be taken through the dental appointments with ease and comfort. You must remember at this stage is that all the theories that we have learned are theories, okay? They are not facts. So you must remember these are theories where people have tried to explain the behavior, but we do not know for fact whether this is actually true or not. But yes, 95% of the population fall into the explanation given by this theory, and hence we are learning these theories. So let's start with the first one. So the stage one, the first stage is the trust versus mistrust. It happens between 0 to 1.5 years of age. And in this stage, when the child is born, he has no confidence in the world and they have no ability to influence the event. So really they cannot do anything. And therefore they depend upon their primary caregiver for everything, okay? For the care that they need, for the attention that they need. And this is where the psychosocial crisis arises. So on one hand, you can have the primary caregiver, who is the mother, who gives consistent, predictable and reliable care, okay? And if the child receives consistent, predictable and reliable care, he develops a sense of trust. He develops a sense of trust in self and in other relationships. So basically he starts trusting people. And when he starts trusting people, he develops the virtue of hope, okay? So he develops this virtue of hope, which means that in need, okay, the person is always hopeful that there will be people who will offer him help or who will offer him support. So if the psychosocial crisis of the kind of care received is consistent, all this will happen. If it is not consistent, so the child does not get consistent and predictable and reliable care, maybe he's in the foster home, maybe the under the care of the grandparents, or the care is just not there. So if the child is crying, he doesn't get milk on time. If the child soils his diapers, it's not changed in time. So the child basically does not receive care, and then he develops the sense of mistrust, so that he cannot trust anybody because the care is not predictable. And then the sense of mistrust develops, and he will not trust anybody around him in this world. So this will lead to the failure of acquiring the virtue of hope. And whenever there is a problem or he needs help, the person will always develop the sense of fear, and then he will mistrust his relationship. He will not trust people around him. He will be anxious all the time. He'll be suspicious of all the people around him, and there will be a heightened sense of insecurity. So this is what happens in the stage one of infancy, trust versus mistrust. So if the person develops a sense of trust, in the dental clinic you will find such children have no separation anxiety, okay? So if you want to separate them from their parents, they will get separate from their parents because they can trust you, because they have developed the sense of trust. But if they have not developed the sense of trust, they will not trust you, and therefore when you try to take them away from the parents, they will cling on to their parents and they will cry and they will not like to be separated from the parents. So you must understand, if this is happening in children, then you must understand they are in the stage of trust versus mistrust, and therefore you have to take appropriate care. So separation anxiety, how do you identify that? Is the patient is extremely frightened and uncooperative. So like I told you, it may not be exactly between 0 to 18 months of age. It can happen with the older children also, because they have not gone past the stage one in their life. So when you find a child who is extremely frightened and uncooperative and he wants to cling on to the mother, whether it's a young child or an older child, understand that they have separation anxiety. So if you find a child with separation anxiety, what you need to do is you have to put in some special effort to establish a rapport, so that the child can start trusting you, okay? So the child can start trusting you, he can start trusting his staff. So this special attention, this special effort, a special time is required to develop that rapport. So for them, you need to spend more than the usual time you need to spend to develop that trust part. And you need to have the parents present in the treatment area, and most of the time the child would want to hold the hand of the parent. So you have to understand that this is separation anxiety, and you have to ask the parent to sit and hold the child's hand to comfort him while you do your examination or sometimes even treatment. So it is okay for the parents to be there. So in the pictures like I have showed you, there are two ways you can do this. On the left you can see the child is sitting on the mother's lap on the dental chair. Okay, so that is also permissible, or you can have mother sit at the side of the chair and just hold the child's hand or touch the child's hand or let the child hold their hand. That is also acceptable. So these are acceptable things you can do for overcoming children who have got separation anxiety. And once the child starts to develop trust in you, right, the parents can be moved back, okay, and the child is more comfortable with you. So this does not happen in the first visit. It normally takes more than one visit. So the child begins to understand what you are saying, and whatever you say is true, and therefore he starts trusting you. So most of the problem that we face here is that you tell the child that this is not going to hurt, and that thing hurts. So the child immediately develops a sense of mistrust in you. Okay, so he knows that you can lie, therefore the child cannot trust you. So you have to avoid such kind of situations. So you have to develop this trust. So you always have to be truthful to the child. Okay, now let's see stage 2. Let's see stage 2. Stage 2 is autonomy versus shame, and this happens from 1.5 years of age to 3 years of age. So if child is developing normally, you will see this stage between 1.5 years, that is 18 months, to 3 years. Now in this stage, what happens is the child is developing physically, all right, and he's becoming more mobile and he's becoming more independent. So if you remember, the child begins to walk at about 11 months of age, and by 2 years they are like running around, climbing things, throwing things, scribbling on the walls. So a lot of things they're doing. So this is the age where they are more mobile and they are more independent, and they want to dress themselves, and they don't like people to dress them. They want to do their things their own way. They want to pick their own toys, and they may want to make their own choices what to wear, and they really get upset if somebody does something for them which they wanted to do. So this is that particular stage of autonomy versus shame. So the crisis here is that if the child is encouraged and supported in their increasing independence, okay, the child will develop the sense of autonomy. So which means that the child will be confident and he will feel secure in their own ability to do a task. Okay, so the child wants to dress themselves. Okay, the parents should not force to them that the parents should dress them. So you let them dress themselves. So the child takes up his shirt. He wants to put on his shirt. He's trying to button his shirt. Okay, so the parent just supports him, just sits there, stands there. Maybe the button is up and down, and then the parents very comfortingly unbuttons and puts the button back and shows the child, teaches the child how it is done. So this is the kind of encouragement and support the child need to develop this sense of autonomy. So once or twice the child will understand that this button has to go here and this button has to go there, and this is how you do it, and he'll develop this sense of autonomy. So once the child develops this sense of autonomy, he will develop the virtue of will, and this virtue of will in the future will help him to survive in the world, because they know that they have the ability to start a task and finish a task. Okay, so they develop this independence. Autonomy basically means independence, so they can do things on their own. Now on the contrary, if the child is undergoing this psychological crisis, okay, where he's trying to be independent, but the child is frequently criticized, he's overtly controlled by the parents, or he's not given the opportunity to be independent. So this typically happens when the parents do everything for the child. Okay, the parents will dress the child, will bathe the child, will feed the child, will do all sort of things, kind of not let them a typical term is called as making them infants all over again. So they are overtly controlled. So in these children, the sense of shame or doubt develops, so which basically means that they are doubtful about their ability to do a task. So they don't have any confidence, and their self-esteem is very, very low. So they have this doubt whether they can complete the task or not, whether they should do the task or not, whether they should start a task or not, and then they will feel shameful. And this virtue of will never develop, and these kind of children who have this sense of shame and doubt will feel insecure. They will have an inadequate feeling of ability to survive independently, and therefore they will always look for somebody to depend on to do things for them, and to rely on them. So this is the one aspect of psychosocial crisis that can happen. So sense of autonomy and sense of shame. Okay, now when the child comes to you in this particular age group, there's few things that you can do because you don't know the psychosocial crisis is going to which end. So you have to take a more general view. So what you must do in for children in this stage when they come to your clinic is have the child think that whatever the dentist wants is the child's own choice. You don't force anything on the child. You take the conversation in such a way that the child feels that I want to open my mouth, so I'm going to open my mouth. It's not that dentist is telling me to open the mouth. Okay, so you have to work your conversation to achieving this. Another one is to give the child reasonable choices to make in the dental clinic. Okay, things like, do you want to switch on the lights, do you want to switch off the lights, the dental lights, or you want a green napkin or a yellow napkin or a blue rubber dam sheet or a green rubber dam sheet. So these kind of choices will make the child uh, uh, feel that he is in command. So that is what is autonomy. So he will feel independent, and therefore they will cooperate with you. And in cases where the child will feel threatened or overwhelmed because now you are getting overtly controlling on their behavior, they will retreat to the separation anxiety. They will begin to have separation anxiety, and you will certainly find the child who was sitting comfortably on the chair and talking to you nicely, and something you did or said, and the child wants his mother, and now he's crying and wants to get off the chair to be with the mother. So this thing can happen. So in this case, you allow the parents to be present during the treatment, even for the simplest of the procedure. So you don't send the parent out or away from the child. Let the child see the parent is in the clinic, or maybe the parent can sit next to the chair and hold his hand and things like that. Okay, and therefore because of this problem, the complex dental treatments are very challenging. So if you have something like multiple extractions, multiple pulp therapies, it is very difficult in these children, and they may require sedation or general anesthesia or pharmacological behavior management to complete the treatment. Okay, so but normal treatment like restorations and topical fluoride applications and everything of primary dental care, it's always possible to do it, provided you take all the precautions and understand the child psychology. So this is autonomy versus doubt and shame, and you will definitely find some children who come and they climb on the chair by themselves, and then they're touching things here and there, and they are trying to push some buttons. So these are the children who have the sense of autonomy. They feel independent to try things. And the opposite would be children who will hide behind their mothers, okay, who will have to be coaxed to come and sit on the chair. Okay, and a lot of uh, encouragement is required for some children to make them come from behind their mothers to sit on the chair. So these are the children who's having the problem of shame and doubt about their ability, whether they can go through the dental appointment successfully or not. So this is shame, this is autonomy versus shame and doubt. The next stage is the stage of initiative versus guilt. It's typically seen in children between the age of 3 and 6. And what happens is now the child is developing. So the last stage was where the child wants to be independent. Okay, so he was developing this autonomy. Now this stage goes on further. Now the child joins the school and he's now interacting with other children, and now he's playing a lot, he's speaking a lot, and children in this age ask a lot of questions because they want to learn everything, and they have this play among themselves, and they plan activities, they make up games, and they initiate activities with others, and they express their thoughts and ideas. You see all these children, preschool children, they will always have this friend circle, and they will keep asking each other, you stand here, you stand here, and somebody will be the leader and somebody will be just following what the other children are saying. So you will have again a psychosocial crisis. Now the child who is asking a lot of questions and he wants to plan his or her own activities, and children who want to express their thoughts, they want to do the things because they think that way. If such activities are encouraged but disciplined, yes, they should not get hurt, but if they are encouraged and supported, they develop a sense of initiative, okay, which means feeling secure in their ability to express themselves, lead others, take decisions, and exercise self-control and have conscience. So these are the children who will develop this sense of initiative, and once this sense of initiative develops, they acquire the virtue of purpose, which means they can exhibit initiative to start a task because they are confident that they are going to finish the task. So this is the sense of initiative. The opposite would be a child whose activity is suppressed through criticism or control, or the parents frequently punish the child or restrict his activities because they think that it is too much aggressive, or not to the parents liking, and such children gets frequently punished and frequently told, don't do this, don't do that, don't do this, put it there, put it, don't touch this, things like that. So such children develop the sense of guilt. Okay, a sense of guilt is feeling being a nuisance to the others. Okay, that means they really feel worthless, and such children will withdraw themselves into a corner, and then they will have this problem of interacting with others because they have the sense of guilt that their ideas are stupid and their talks are stupid, so they will not express their ideas and thoughts freely, and they will not interact with others, and the whole virtue of purpose will be lost, and they will show no initiative to start a task because they are not confident to finishing the task. So these are the children, again, these are the ones who will be in the clinic, who will be silent, okay, who will not communicate, who will not make eye contact, okay. All your advances to open them up, okay, will not work immediately because they are slow to interact with others, and they will be very shy to express their views and thoughts. So you ask them a question, do you like this color, and it will take some time for them to answer. Okay, they will not answer immediately like a child who has got a sense of initiative. He'll immediately say, I like it, but this is too dark. Okay, I like it, but this is a black spot is here which I don't like. So things like that will happen. All right, so this is initiative versus guilt. So let's see what dental application we have. So most of the child who will come to the clinic will be in this age group 3 to 6, and we need to carefully manage this child because our actions, our words can either reinforce the initiative or sense of initiative, or can initiate or reinforce the sense of guilt. Okay, so in this kind, if again you tell the child, don't touch this, don't do this, okay, sit there, I will punish you, things like that, then the child will have this sense of guilt reinforced. Okay, or for the child who's having sense of initiative, he will take it as a discipline that he has to learn. So don't touch it means don't touch it, something bad will happen, so this will happen. So what you need to do, understand is, again, because you don't know the child is having crisis on which side, so it's always best for this age group to have an introductory visit for the child with the mother. And at this stage, the child will be curious to know about the dentist office, and they will be eager to learn about how things work there, and what happens if you touch this, what happens if you touch that, why are you wearing this, why is it there. So they'll have a lot of questions. So you have to have this one introductory visit before you plan your appointment to make sure that child understands everything and he's more comfortable when he comes for the appointment, the treatment appointment. So it is very important, again, like I said, you have to construct this introductory visit as a new and challenging adventure which the child will ultimately complete successfully, and then he will have this sense of independence. Okay, so the problem of dependence will go away and he will develop the sense of independence. Yes, I can do it, I can sit on the chair by myself, I can hold the suction tape, okay, I can talk to the dentist, and the independence will come. So you have to make sure it happens by constructing the stages of introductory visit very carefully. Okay, something like, can you switch on that light for me, can you switch off that light for me. Okay, do you know how this works? It works like this, and then you ask him to repeat it, and then he will develop a sense of independence. So after this initial visit, the child will usually behave well, and he will sit independently on the chair with no separation anxiety. But again, you must remember, if something bad happens, they will again go back to separation anxiety. So it's always better to have the mother in the treating area or operating area in case that happens. Okay, so now let's see the next stage. Okay, the next stage is the stage 4, which is industry versus inferiority. So Imagine a child who is developed successfully from the previous stage. Now they've finished their preschool and now they enter their middle school and high school, and these are the children who will start to learn more and read more and do more maths, some, and study more language, and they will try to do the things on their own. And the important thing is that they will feel the need to win approval of teachers, parents, peers by demonstrating specific competencies that are valued by society, and being and begin to develop a sense of pride in their accomplishment. So if this is the age group, you will find normally in the school you will have a lot of competitions, fancy dress competition, poetry reading competition, and all the parents are pushing their child to perform well and get some prizes. And this is basically what happens is the child feels the need to um, win the approval of the teachers. The teachers must tell me that I am a good student, or I'm a good boy, and they will have the sense of pride that yes, I have done this, and my teacher has appreciated me, or my friend says that it is really good. Now, because they have developed that specific competencies, maybe that specific competency could be reading out a poem loudly and in a flow, or it can be doing math sums the fastest, things like that. So here again the crisis will occur. So if the child is encouraged and reinforced for their initiative, okay, and that they're doing some things and you are encouraging the child to do it, you are supporting the child to go for competitions, and even they don't win, you still support them and encourage them, they develop the sense of industry. So they will feel competent, they will feel industrious, and they will be confident on their ability to achieve goals, right? So, and they will work towards achieving goals, those who have sense of industry. So you'll find that certain children between these age groups, they study a lot, okay, and they want to be on the top of their class, and maybe they want to play well, they want to play football well, and they want to be in the school team, and they will have the sense of industry, the sense of direction. So these children will develop the virtue of competence, and they will be the ones who will not hesitate to compete with others. And when you say compete with others, they will also be able to cooperate with others, okay, because some of the things may be a team sport or a team activity. So these are the children with sense of industry. Now, if we have a child who is discouraged and restricted by the parents, who is not encouraged for their initiatives, okay, who is frequently criticized, okay, for example, doing math sums wrong all the time, and the child gets punishment from the parents, and they feel they start to have this sense of inferiority, which basically means that the child will feel that I am inferior to the others, and then he has a self-doubt that whether I have the specific skills which the teacher needs or with the parents need, okay, which the society demands, right? So there's a certain demand for children to be athletic, to participate in all the sports and will win prizes for all the sports, and then the child is not able to do that. He is constantly reminded of his failure, and he's not encouraged. So they will develop the sense of inferiority. So children who develop the sense of inferiority will not have this virtue of competence, and these are the children who will not like to compete with others for a task, and these are children who will not like to enter into competitions because they fear that they do not have the skill required, and then they will miserably fail. So this is the sense of inferiority. Okay, so now let's look at how we apply this in dental clinic. So again, like I said, you don't know the child is facing the social crisis is on which side of the balance. So what you do is, from your side, you set some attainable goals, okay, and you clearly outline for the child how to achieve these goals, and you positively reinforce the success in achieving this goal. So you're trying to be supportive of uh, their initiative and making sure that they are on the industrious part of the social crisis. So example would be, to ask a child, if you sit on the chair and you will open your mouth and let me count your teeth, okay, and once we do that, and if you can do that for me, that will be awesome. And then the child does it, and then you give him a reward for his good behavior, and then he feels industrious, or he feels the sense that he has started something and then he's accomplished it, and then for your approval he will try to repeat the same behavior. So next time he will come, he will open the mouth by himself, he will let you do the treatment, and then he will get his reward for the good behavior, and use and give some positive reinforcements like a good job, good boy, excellent, here's a gift for you, here is a reward for your good behavior, and then they will have this sense of being industrious. So now whether a child will follow the dental advice is determined by whether he or she understands what is needed to please the dentist and the parents, whether the peer group is supportive, and whether the desired behavior is reinforced by the dentist. Okay, so the basically child must be able to understand what is expected of him, and that expectation is going to please the dentist or the parents. So if the child does not understand this expectation, then he will not behave properly in the dental chair, because he will be confused on what to do. And similarly, children of this age will have some peer groups, and like I show you in the picture in the center, they will show their teeth to each other, and they will like, my teeth, your teeth, kind of a thing. And there you can use that peer group support to have treatment done for them. So you have topical fluoride done for the older child, you can have topical fluoride done for the younger child. Now because they are like supporting it, one will say to the other, it's okay, nothing happens, see, all is well, and things like that will happen. And then of course you reinforce the good behavior by giving them some rewards or praising them, then they will definitely start to cooperate. The picture I show you on the left one, the tooth fairy, it's a certificate which is given to the child when they have their first deciduous tooth um, exfoliated, and the new one is coming, and then they get the certificate, and then they feel that it's okay, the whole dental treatment was not a big deal, and I could go through it. So things like this will happen. So in this stage, you must remember that the child cannot understand abstract concepts. Abstract concepts like you cannot tell the child, if you get this filling, your bite will be better. What is this bite is abstract to the child. The child cannot understand what he means by bite, because he cannot feel it, cannot hear it, cannot touch it. So the children will not understand any abstract concepts. So the better wordings to use is, if the child is getting a filling, is you can tell them, if you get this filling, your teeth will look whiter. This they will understand. Okay, this they can understand, and then they will, once they understand, and they will start cooperating. So you use this stage and these techniques for children coming to a clinic in in this particular age group. So let's see the next stage. The next stage is identity versus role confusion. Okay, so this is 12 to 18, and this is the typical adolescence period. And in this period, or in this stage, the child is becoming more independent, and now he's looking into his future career, what he needs to do in life, and what is his role in the society, and how can he fit into the society. And in order to do all this, they start exploring their self of sense and their sense of direction in life and their role in society, and then they will do a lot of experiments, and therefore you call these adolescents. They're doing some crazy things because they're adolescents, so they are trying to develop the sense of self, sense of direction in life. So they will do a lot of experiments during 12 to 18 years of age, and the crisis here is that during these experimentations, if the child is able to form his or her own identity, okay, based on the outcome of their expectations, they develop the sense of identity. They understand, or they know, who am I and what am I supposed to do. A typical example is that academically 12 to 18 years is where your parents will be telling you that you have to become a dentist or you have to become an engineer, and the child will explore these areas, and then he will say, I think I can be a dentist because the society needs a lot of dentists, a lot of people with dental problems, and there is a need for a dentist. So I think I want to be a dentist, and therefore the sense of identity develops, that I am, and what am I supposed to do for the society. And once the child develops a sense of identity, they acquire the virtue of fidelity, which basically means ability to relate to others and form a genuine relationship. So basically, once you understand that how you fit into the society, then you start making your networks, and then you start relating to others. Now the opposite would be a child who's undergone this psychosocial crisis. That means he was experimenting with his life, that what he has to do when he grows up, and he could not form the identity they were looking for. Okay, So they develop the sense of role confusion. So they have this identity crisis. They don't know who they are. They don't know what they're supposed to do. And these are the children who will be rebellious. You can really cannot tell them, force anything on them, because they're confused. Okay, so you cannot pressurize anybody to be an engineer because he is not sure whether engineering is the right career for him. So he will try to rebel back. He'll be like, no, I don't want to be an engineer, and things like that. So this will basically lead to a lot of unhappiness in life, and of course low self-esteem, because the children who have sense of role confusion, they're not sure what to do. They're not sure of their abilities to do anything. So they will have this problem that they will not have the virtue of fidelity, and therefore they cannot relate to others, and they cannot form relationships, which is very important for the next stage. So when the child comes to you between 12 to 18 years of age, okay, let's see what you are supposed to do for them. So in this particular age, you must remember that parental authority may be rejected by the child. So the child may have been brought to the clinic not by his own will, but because the parents wanted to bring the child, maybe because the child has got some crooked teeth or a broken teeth, and the child is fine with it, but the parents are pestering the child to get it done. Okay, get the filling done. So you'll have this problem that there will be a conflict between the child and the parents in front of you on the dental chair because of this. So understand that it is normal. And any dental treatment that you initiate, it has to be based on the patient's want, not to please anybody else. So if the patient wants it, do it for them. If the patient doesn't want it, don't do it for them, because they will keep complaining about the treatment, and they will keep complaining that they were forced to do this and they don't like it, and then you develop a bad reputation or bad rapport with the patient. So do dental treatment only if the patient wants you to do it for them. Don't just do it because the parents want, or the grandparents want, or somebody else of authority figure wants. So for them, the motivation to seek dental treatment can be either internal or external. So the external motivation will be pressure from the parents, pressure from the peer, or pressure from an authority figure. Okay, most of the times like grandparents, or the eldest uncle, or the eldest aunt, or something like that. But here you must understand the peer pressure starts to develop. All right, so this could be an external motivation. The internal motivation is an individual's own desire to correct a defect that he perceives in himself. So he himself wants to do it, right? So most of the time you will see the patient coming for correction of malaligned teeth, and the patient themselves are very motivated to get the orthodontic treatment done because they feel that their teeth are crooked and they're not nice looking and they don't have a nice smell. So you will suddenly sense that the patient is very, very cooperative because the internal motivation is very high. So you can go ahead and do, if he requires extraction of premolars, you can do extraction of 2 premolars in one appointment, and those children will be like, you can, doctor, go ahead and extract the other 2 also, I'm fine with it. So they're so motivated. So you understand that this motivation plays a very, very important role. And like last time we saw that the children do not develop this concept of abstract concepts. Abstract concept means the things that can only be visualized mentally, which cannot be touched, felt, or cannot be heard or seen. So these abstract concept starts to develop more readily. So when you say your bite will be better, the child will understand what the doctor is saying by the bite and the teeth closes together, and the things will be comfortable and there will be no pain. This kind of concept they understand in this particular age group. Now 2 things happen in this age group. One is the imaginary audience, and the other one is the personal fable. So these are the 2 stages of adolescence. So in what imaginary audience means, that the child will have a belief that all eyes are on them, and everyone is looking at them, everyone is talking about them. Okay, so this is the imaginary audience. It's just kind of a feeling that I am on the stage and everybody is watching me, everybody is looking at me. So they have this feeling, but actually all the children, all their peers or in their age group will have the same imaginary audience. So basically nobody is looking at anybody. Okay, they all are in their own worlds. So because of this belief that everybody is watching me or looking at me, children will normally come to the dentist and they will want to have treatment done which is not required. Okay, maybe like teeth whitening, where the teeth is already white, or they want to have some aesthetic treatment which is not required, or these are the children will have a lot of rigorous toothbrushing causing tooth erosions because they feel that everybody is talking about their teeth. So they have this kind of imaginary audience. The other one is the personal fable, which is belief that the child believes that he's invincible. That means nothing can bad happen to him, and he's entirely unique and a separate person, different from the others. And this is the personal fable which attracts or which leads the children to try things like smoking, right? Because they feel that oh, I can't get a lung cancer, only the older people get lung cancer, I'm okay. So this personal fable leads the adolescent to start smoking or speeding in the cars or their bikes, and they will be careless about their brushing if you talk about dental. And they're like, okay, this gum disease will never happen to me, it's okay if I brush only once a day or once in 2 days, nothing will happen. So they have this personal fable. So now let's look at how we can work with children who are in this particular age group. Okay, that was how you work. You have to be supportive of them. We will go back to this later when we talk about the theories of cognitive development. We'll shed some more light on the imaginary audience and the personal fable there. For now, let's see the stage 6, which is the intimacy versus isolation. And this is 18 to 40 years of age. So for pediatric dentistry, basically the child goes from pediatric dentistry to adult dentistry. But as a general dental practitioner, you will come across children now young adults in this particular age group. So here in this age group, these young adults are exploring long-term relationships with someone from other than their family members, and then they want to share themselves more intimately and start a long-lasting relationship. And then the psychosocial crisis occurs. So what the crisis is, that if they're able to form intimate and loving relationship with other people, okay, they develop this sense of intimacy. The sense of intimacy means a sense of commitment, safety, and care within the relationship, and they have happy relationship. And the virtue that they develop is the virtue of love. The virtue of love is willingness to compromise and even to sacrifice self to maintain a relationship. So this is the virtue of love. So these kind of young adults who develop the sense of intimacy ultimately go on to have this virtue of love. But on the other side, if the young adult avoids intimacy and he fears commitment, and then he fears relationship, they will develop sense of isolation. So they will be isolated, they will have no relationship, all the relationships will never work out, and then they will have this feeling of loneliness, and they will have this depression that I am all alone in this world, and they will not develop the virtue of love, and they will keep themselves isolated from the others, and they will develop prejudices against others, and they will develop attitude that will keep others away, and they will not let others come closer to them because they have developed this sense of isolation. Of course, this can be reversed with proper support and care. This can be reversed, and these young adults can go back to sense of intimacy. But again, like I said, it may be delayed for them, so things like that will happen. So in this particular young adulthood, you must remember that the intimate relationship develops because of appearance, personality, emotional qualities, and intellectual qualities, among many, right? And then if you are going to change the physical appearance of the person, maybe by orthodontic braces or orthognathic surgery, or you're gonna put some ceramic crowns on the maxillary anteriors or the mandible anteriors, which is gonna change the appearance, you must remember that there will be a potential problem which you need to discuss with the adults about having the appearance changed, so that the intimate relationships are not affected. So you just have to be cautious to explain to the person, the young adult, that your appearance will change slightly and should not be a problem with your spouse or your girlfriend or anyone who is having an intimate relationship with you. So this is very important that you speak and communicate the change of appearance, especially when you're looking at aesthetic dentistry. The stage 7 is generativity versus stagnation. This is middle adulthood, 40 years to 65, and this is the time when the people experience a need to create or nurture something by which the others who will come after them will remember them for that. Okay, so they're like creating a mark for them in the life, so that others can remember them by the things that they have done. So they will have this need to create a positive change that will benefit other people, right? So you have all these foundations, philanthropic foundations, which offer money, scholarship, and everything. So those are the things part of this particular age group. So again, the psychosocial crisis that will arise here is that if the person is able to create that positive change that benefits other people, or they fail to create the change. Okay, so if they're able to give back to the society by being productive at work and being involved in community activities and organizations and giving back to the society, they will develop the sense of generativity, which is a sense of usefulness and accomplishment in the life. So they will have this virtue of care, and they would want to guide the generation coming after them. So this is what happens with a particular sense. But those who fail to find a way to contribute or for the benefit of others, or they cannot contribute to the benefit of the society, they will feel this sense of stagnation and feel that they are being shallow in the world, and they have not able to create a change in the world, and they will have this sense of failure, that they have not done anything for the society. And then they are the people who will not develop the virtue of care, and you can recognize these people because they are self-indulgent and they are self-censored, self-centered, and they're quite like selfish kind of a people. So you understand that between 40 to 65, these two things can happen. Obviously you can, the successful outcome would be sense of generativity, but people who are in the sense of stagnation may feel the sense of stagnation for a particular years of their life until they are able to give back to the society, and then the sense of stagnation will change into sense of generativity, and then they will progress to the next stage. So let's look at the next stage. The next stage is ego integrity versus despair. So this is where is the late adulthood, 65 years till the person dies, and this is the age group where people retire, and then they look back at their lives and they try to assess their lives, reflect back on their lives. And the crisis that arises here is that if they feel their life was productive and the life goals was achieved, they feel no regret in life, they will develop the sense of ego integrity. That means they feel that one has made the best of this life situation and has made peace with it. So they will have this sense of calmness, and they will develop this virtue of wisdom, which is basically looking back on their lives with a sense of closure and completeness, and also accept death without fear. So these are the people with wisdom who will give you good advices what to do in life, because they have seen the life, they have reflected on the life, they have learned a lot of mistakes they have done and they have learned from them, and then they will give you some wisdom to learn. The opposite would be the sense of despair. So these are people who feel that their life is unproductive, and they feel guilt about things they have done in the past, and they feel that their life goals have not been achieved, and then they feel the sense of incompleteness, and therefore they will have this they will be dissatisfied with life, and then they will feel despair that they have spent their lives which is not worth it, and they have not achieved anything out of it. And these are the people who will not have wisdom, and they will have depression and hopelessness, and then they will fear that death will occur before attaining the sense of ego integrity. So this can happen to them. So this you may come across people who are in this stage. If you are doing geriatric dentistry, you can come across, and then you'll have to look at the ways how to handle this. For pediatric dentistry, we're not going into the details of this, but just for the sake of completeness, for you to realize the full stages and what happens, that you must understand the whole theory in a wholesome theory. So these are the 8 stages of Erik Erikson's uh, theory of personality development or emotional development. All right, so before we go on to the next theory, I want you to take a break, go have a glass of water, stretch yourself, right? Have a cup of coffee, have a cup of tea, and then come back. So we look at the next theory of cognitive development. Okay, so this theory of cognitive development, cognitive or cognition basically means understanding. Okay, so when you say understanding, we're looking at the mental process. Okay, mental process. How does a person think inside their head? So Jean Piaget came out with a theory of cognitive development, where he tried to explain uh, why people do the things that they do, depending on trying to understand how the mind works for children. Okay, so he said children are like scientists and they perform experiments, they make observation, and that is how they learn about the world. And as they interact with the world around them, they continually add new knowledge, build up upon existing knowledge, and adapt previous held ideas to accommodate new information. So like a child is constantly experimenting, learning new things, letting go of the older things, or taking new things, modifying the older things, and things like that will happen. So he said cognitive development is a process which occurs due to biological maturation and interaction with the environment. Okay, so unlike the other theories, he is more into the mental process. And to understand this theory, there are three things, or the three components of the theory that you must understand. Is one is schema, the other is adaptation process, and the third one is stages of cognitive development, where we actually look at the stages. All right, so let's look at the first one, the schema. Now schemas are basically the units of knowledge. Okay, what it means is that when you look at something, you develop a knowledge of that thing, and then that knowledge is stored in your brain in a box. Okay, now let's call this box as a schema. So it's basically unit of knowledge. So if you see another thing, you develop the knowledge of that other thing, and then another box in your head will develop. Okay, and that is the schema for that particular head. So schemas are basically the units of knowledge, and each relating to one aspect of the world, including objects, actions, and it could be an abstract concepts also. All right, so the example that I have put for you here is in the picture, where the boy saw an aeroplane, and from the existing schema he called it as a bird, and this is called assimilation. So just imagine that boy sees a bird for the first time. All right, so the mother tells the boy, look here child, this is a bird and it has got wings and it can fly. So the child now develops this schema or this knowledge box in his head. All right, now this schema is developed in the head. So similarly, you will have schema when you go out to do to eat, right? The schema in your head is when the first time you went out to eat, you had no idea what to do, right? So maybe you went out with your family, and then you are develop the schema that you go to KFC, you sit there, you look at the menu, you order the menu, then you wait for your meal to arrive, and then you take your meal, and then you go back home. So these is the schema for eating out. All right, so these are the schemas or the knowledge boxes that you have in the child. So in this picture that I've shown you is the boy. There's a concept of assimilation, and there's a concept of accommodation, where the child understands that the schema of bird, okay, can change over a period of time when he faces a new thing. So he had the schema of bird, and then he watches the airplane, then he cannot fit the schema of aeroplane into the bird, and then he develops a new schema of aeroplane. So let's look at this, and this process is called as adaptation. So what is the adaptation process? Is basically a cycle of assimilation, accommodation, and equilibration. So assimilation means the process of taking in new information into our existing schema, right? So what it basically means that in the bird example that we saw in the last slide, so the child has already developed the schema of bird. So now when he sees anything that has wings and flies, the child automatically labels it as a bird. So this is an assimilation uh, of the new object into the child's bird schema. So anything that flies and has wings, he'll call it as a bird. So he will not be able to differentiate between an eagle and a parrot and a pigeon and a vulture. No, everything will be bird.
Okay, so this is the schema of bird. So he will assimilate all the new objects into the schema of bird. Now, as he grows older, he will also have to have accommodation, which means changing or altering the existing schema in the light of new knowledge. For example, the child learns that an aeroplane, which also has wings and flies, carries people from one place to another. So this modifies the existing bird schema as a result of new information and new experience. So that means now the child will accommodate aeroplane into his bird schema. So he can do that maybe by having another schema of aeroplanes, right? So in that schema of aeroplanes, anything which is flies and carries people will be called as aeroplanes. So in that schema of aeroplanes, you can have jet fighters, commercial flights, a cargo plane, and everything. So he will develop probably a new schema different from the bird schema. And once he develops that cargo plane is different from a passenger plane, again the new information that okay, all planes do not carry passengers, some only carry cargo, then he will again try to accommodate the new concept of cargo planes into his existing schema. So this will keep going on. So there has to be a balance between assimilation and accommodation, and it is very important the child is able to balance it by having proper support by parents from the teachers, so that he is able to have this adaptation process without fail. So any lagging or any problem in this equilibration will cause a problem in understanding of the child, and the child will have difficult understanding things because now he cannot have his schema, and he cannot take in new information and cannot adjust or cannot accommodate it is in his existing schema, and then they will have problems of understanding simple procedures or simple things. So this is the process of adaptation. Okay, so now let's dig into the actual stages of cognitive development. Okay, how does the child starts to think, okay, mentally? So there are 4 stages. Starting from your left, you have the sensory motor stage, birth to 2 years, and the child is holding the glass. So the glass is basically just a glass of water. But when the child progresses to pre-operational stage 2 to 7, he understands that the liquid in the glass is water. All right, and then he successfully crosses that, he comes to the concrete operational stages. Then he will learn that the water can be divided between 2 things, and he'll have this concept of idea of consistency. Once he finishes that, he goes to the formal operational stage, where he will look at a glass of water, and then he will have this philosophical thought of whether the glass should be considered as half empty or half full. So this is the 4 stages of cognitive development. Now let's dig into each stage and see how it helps us in our clinical practice. All right, so sensory motor stage, birth to 2 years, and in this stage the child is basically trying to learn about the world by sucking on things, by grasping things, by looking, and by listening. So these are kind of innate reflexes the God has given, and then they use these senses in order to understand what is happening around the world. In this stage, as the child is towards the 2 years of age, they will learn that things continue to exist even though they cannot be seen. So typical example, this is called as object permanence. So what it means that, like I have shown you in the picture here, to begin from the left. So the child is given an apple and 2 white sheet, and if you put the apple under one of the white sheet, okay, and the child sees that you have put the apple there, and then you try to distract the child and take out the apple and put it into the other sheet and ask the child where is the apple, he will think the apple is still there where you have kept it, and then he will look for it under the sheet. So he still thinks the object continues to exist even though they cannot see it. So this is called as object permanence. Other things that child develops is that he will try to they will feel that they are separate beings from other, and they feel that are separate from objects. So they will do a lot of exploring of the world around them, okay, and then they will realize that their actions can cause things to happen in the world around them. So they will scribble on the walls, and then they will get a shouting. They will understand, okay, my scribbling has got me shouting, so maybe they will not do it again. But children are still learning, so they will understand the actions have consequences, and they will also begin to attach names and words to the object. And this is the time where they will learn the names, like, you know, he is Baba and he's Mama, and things like that. So they'll start attaching name to the objects. Maybe they start to learn a few objects like apple or water or tea. They will attach names to the objects. So in this stage, the communication is extremely limited because they have not developed the language abilities, and in this stage, the child also has little ability to interpret sensory data, and has limited ability to project forward and backward in time. So they will basically not understand tomorrow and yesterday. That is what it's meant, and they will not understand uh, the sensory data. So this is nice, this is good looking, or this is hot, this is cold. They will not understand this is hot or cold. Okay, they just understand this is hurt or this does not hurt. So for us in dental application, because the communication is extremely limited, we have to, know that child will not communicate with you. All right, and this will lead to things like you have to use physical restraint to examine the child. Like I've shown you in the picture on your right, is the knee-to-knee position, and where the child is head is on the lap of the dentist, and she's examining the teeth. So you have to use some kind of protective stabilization to examine the child. All right, and at this stage the child has little ability to interpret sensory data, and limited ability to project forward and backward. So they'll really not understand all of the dental advices you give them. All right, so basically, so don't all the advices has to be focused towards the parents. So this is for the first stage. In stage 2, which is pre-operational stage, and it lasts from 2 to 7 years of age, and in this stage the children start to think symbolically. That means they will try to give words and pictures to everything. Like the picture I've shown you, the child is holding a banana, and it's a symbol of a mobile phone. So children in this age group, more younger ones, will do this. You must understand that 2 to 7 years is a very wide range, and for purpose of simplicity, we are not going into the sub stages of this particular stage. Okay, so there are like sub stages from 2 to 7. So we are not going to the details of that because it's out of the scope of this syllabus. But what you must understand is that they will attach symbols for everything. Like children who are older, maybe 6-year-old, 7-year-old, they will do things like use a broomstick and think it's a horse, and then they will go around the house playing with the broom as if they are riding a horse. So they will have this particular mental development, and they tend to be egocentric. And egocentric means they cannot see other people's point of view. So if the mother says this shirt is not looking nice on you, he will not understand. He will feel that this shirt looks nice on me, so this shirt looks nice on me. So mother is saying it does not look nice on me, he will disregard the mother's opinion because he has this egocentric approach. So he will not see things from the other people's perspective. So if you say don't touch it, it's hot, okay, the child will still go ahead and touch it until he feels it's actually hot. So he will not see things from other people's perspective. So this is called as egocentric. Then they will have this difficulty in understanding the idea of constancy. Okay, so this experiment is done to see if the child has entered into pre-operational stage or he has gone past the pre-operational stage. So what you do is that the child is first shown 2 equal sizes of glasses with water in them, and then the child agrees that both the containers contain the same amount of water. Then the content of one glass is poured into a taller, narrower glass while the child watches. Now when you ask the child which container has more water, the child will usually say that the tall glass has more water, because now they see the level of water is higher. All right, so they have this is called as liquid conservative test. Okay, so this is the idea of consistency. Even though the volume of water is both the same in the tall glass and the small glass, they will not understand this part. So you must remember that the thinking is still concrete. So concrete means that they have to see in black and white. They cannot understand again the abstract thoughts. So they will have this concrete thinking that they have to sense the things around them with the 5 primary senses in order to make sense, and they cannot understand abstract things like which they cannot see, hear, or smell, or taste, or feel. Okay? Like example, chew effectively, they cannot understand that part. And interestingly, this is the age where they have they will feel that everything that is seen is alive, and this is called as animism, right? So like I've shown in your picture, if you can, identify the movies that these two pictures are the part of, can you identify the movie? Yeah, one on the left is Ted, and one on the right is Winnie the Pooh. So there are two movies which have been made on this concept of animism, where apparently non-living objects are brought into the life, and children in this age group find this very fascinating, very interesting. Okay. So how we use this in our dental practice? So this the concept of animism. We can give dental instruments names, lifelike names and qualities, and then the child can relate to the instrument. So typical example is your handpiece, and handpiece makes noise. So you can say this is Mr. Willie the Whistler, and you can say when Mr. Willie is happy cleaning the teeth, he whistles. So the child will develop uh, a relationship with the handpiece because now he is able to understand because of animism. Another way is to distract the children with storytelling during the procedure to hold their attention. So you can tell them a lot of stories, make believe stories, and they will have no problem in believing that it's true, right? So you can use this storytelling for children in this particular age group. Now these children have egocentrism, so you must understand that the child can understand how proud his father would be if he brushed every day, since the child would think his father's attitude is the same as the child. So you have to tell the child, uh, your father will feel so nice because you will have nice teeth, okay? Or you want to have nice teeth, see how proud it will make everyone, and then suddenly they'll feel that everyone will feel proud, and then they will kind of agree with you on certain things. So this is egocentrism. The third part or the last part of is the concrete sensations. Children in this age group need to feel and see things. Okay, so we use concrete sensation rather than abstract reasoning. So you cannot tell them, cannot tell them, look here, you need to maintain oral hygiene. They will not understand. All right, so they cannot understand things like brushing and flossing remove food particles, which in turn prevents bacteria from forming acid, which cause to decay. Oh, this is going to go bouncer. Okay, so what you can do is you can rephrase it for them to better understand. Okay, you can tell them brushing makes your teeth feel clean and smooth. So this they can feel. After you do prophylaxis for them, they can feel the teeth is now clean and smooth. And you can also tell them the toothpaste makes your mouth taste good, because now they can taste the toothpaste and then they can realize, yeah, the toothpaste can make my mouth feel good, taste good. So this is the abstract sensation. And lastly, the child view will be centered in the present, so he cannot really understand to see in the future. Okay, so they cannot look forward or backward in time. So you cannot tell them things will get settled tomorrow. So you do an extraction and then the child is having some discomfort, you cannot tell them the discomfort will settle tomorrow, by tomorrow. They will not understand. Okay, so because they want things, they understand things which is happening at the moment. So you need to take care of this when you're treating children in this particular age group. The stage 3 is the concrete operational stage. This lasts from 7 to 11 years of age. All right, and in this particular stage, still the idea or the mental process is concrete. That means they must feel and see things to understand. But the egocentrism and animism begins to disappear from 7 to 11. By the time it's 11, you cannot. They will. This egocentrism and animism will disappear. So basically, if you want to tell them a make-believe story to an 11-year-old boy, he will tell you, dog, it's not possible, don't fool me. So this is what is cannot use animism for them. So they start to understand that their thoughts are unique to them, and that not everyone else necessarily shares their thought, feelings, and opinions. So this is opposite of egocentrism. Now they will start appreciating the thoughts and ideas of other people, the opinion of other people. And this is the stage when the children will begin to use inductive logic and reasoning, working from specific information to a general principle. Like I've shown you in the picture, that the cat gives the child allergy. So the child will understand the cat is giving me allergy from the fur. So he will not want the cat anymore. So he's now doing inductive logic reasoning of his allergy. So this kind of reasoning develops for such children. Okay, now this is the time that they will understand the test of conservation of liquid, the idea of constancy, which we saw the child in the earlier stage cannot do. So an 8-year-old can watch the water being poured from one glass to another, and he can imagine the reverse of the process. This is called as concept of reversibility. So he will understand, okay, the water is coming from the same beaker, and then he will conclude that the amount of water remains the same no matter what size the container is. So he can tell you, oh, it's the same water, even though the tall glass has got more water, but the amount of water remains the same. So this is the idea of constancy develops. But you must remember that if you give the same problem in writing, they will not be able to solve it. But if you show them, they will be able to understand. So here the child's thinking is strongly tied to concrete situation. That means they're able to see and hear, and the ability to reason on an abstract level is still very limited. So don't use things like oral hygiene with them. Again, it will not work. So let's see what we can do for them. For them, when you give dental instructions, make sure it is illustrated with concrete objects. Okay, you have to give them the brush in their hand and the model in their hand, and then show them how to brush their teeth. Okay, so you cannot just tell them that you need to brush every day to keep your teeth free from decay. They will not understand this idea how it will keep it decay free. So you have to use concrete ideas. So example, you can say this is a toothbrush and you have to use it like this and like this. You demonstrate the brushing demonstration to clean your teeth. So you have to do this once in the morning and once before bedtime. So this is very clear cut, understandable, and illustrated, that they can remember, and then that things that they can do. So example here I've shown in the picture. So this would be an ideal oral health brochure for a child in this particular age group. So you must remember these things. Let's see the next stage. So next stage, or the last stage of this, is your formal operational stage, and it lasts from 12 years and above. All right, so you see this young adult sitting there and playing chess. All right, so they are in formal operational stage of mental development or cognitive development. So these are the people, or these age group will begin to think more about moral and philosophical and ethical and social and political issues that require theoretical and abstract reasoning. So they now are able to understand, and they begin to use deductive logic or reasoning from general principle to specific information. This is opposite of inductive logic reasoning. All right, so they start to work from general principles to specific information, and they are also capable of seeing multiple potential solutions to a problem, and they think more scientifically about the world around them. So basically they are very smart group of children, and they're able to understand abstract ideas like prevention of disease and the concept of health and concept of well-being. So let's see how we can work with them. Remember imaginary audience we spoke about in the last theory. Again, here the child, the person or the adolescent is self-conscious, and he's particularly susceptible to peer influence, and he's worried about what the peers will think about their appearance and actions, and they will not realize that the others are too busy with themselves to pay any attention to anyone else. And this is the time that they will come request for say orthodontic treatment when it is not actually indicated, and then they'll come to you and they'll tell you they've got the spacing between their upper front teeth and they want this filled, and when you find it's like the natural structure of the tooth is like that, and nothing can be done except for aesthetic reasons. So they will come and ask you for a lot of aesthetic treatment which may or may not be required. So you need to be really careful on that, because they are very self-conscious and they are susceptible to peer influence. Then we also looked at personal fable, where the person thinks that I am unique and I am not subjected to consequences others will experience. And this is the time that they will try to do a lot of experiment with smoking, and all risky behaviors they will have. And you must understand that the child's may be in the stage of personal fable when you are dealing with them. So let's share an example that I found from a book to understand how you deal with such children or such adolescents. Now they're not children anymore. So all you can do is be considerate of their emotions and their stage of development. Okay, so this is illustrated by the story that I'm going to read out to you. This is story of a 13-year-old Beth who lost a maxillary central incisor in an accident, and she was given a removable partial denture to replace the tooth until her growth is complete. So once the growth is completed, we can then go and give her an implant or put her on a fixed bridge. And so this removable partial denture is kind of a temporary solution to the problem, but she requests if the bridge could be done right away. All right, and sensing a problem of imaginary audience, the dentist commented, Beth, wearing this partial denture must be a problem. Tell me more about it. And Beth replied, it's embarrassing. So now the dentist is being considerate of the emotion, and then he's trying to explore what is happening, because now he understands that imaginary audience could be a problem, because other people, the peer group, may be thinking that it's really weird that the single tooth removal partial denture is there. So on inquiring further, the dentist asked, when is it embarrassing? So Beth said, when I spend the night at other girls' home, like a night out or a pajama party, and I have to take my denture out to brush my teeth, it's embarrassing. So the dentist asks, well, what is the response of other girls when you see you remove your tooth? And the Beth replies, they think it's neat. That means it's not a problem, it's not an issue. And once Beth says this, Beth herself understands that the imaginary audience is not a problem here. It was her who was thinking of imaginary audience. Everyone is cool with her partial denture, so she understands that there's nothing to worry about it. So this happened only because the dentist was considerate of her emotions, and then he spoke with her and communicated with her, and then automatically Beth understood the problem, and then the things settled down. So this is what you can do for children in this particular age group. You have to be considerate about their emotions. If the child is coming with a problem of spacing between the teeth and there's nothing wrong with the teeth, maybe you just have to sit and talk, and the situation can be resolved without any unnecessary unwanted dental treatment. Okay, all right, so we are approaching the conclusion of the presentation, and this is a particular quote that I have read in a book, and I find it very interesting. It is in relation to the emotional development of the teeth and emotional development of children, and it says different strokes for different folks, right? So children vary in their intellectual development, in the psychological development, in their physical development. So every time a child comes into the clinic, right, you really have to spend time to understand. And you, like we have seen, the child can be in so many stages, and can be in so many transitional stages. On one side, psychological crisis, emotional development, operational development, so many things are there, and this is what makes pediatric dentistry pediatric dentistry. And that is why pediatric dentistry is not a cup of tea for everyone. All right, because you have to put in so much thought into the child's psychological development in order to control the child's behavior in the clinic, so that you can do the procedure. So doing the procedure is not an issue, but controlling the child's behavior to do the procedure is what is pediatric dentistry. All right, so remember that. So with this, we end this session on child psychology 2, and I want you to take a few minutes to recapitulate what we have learned in this session. This was quite a long session. We have learned, maybe you ask yourself, how many theories did you learn in this session? You just try to jog back your memory and just try to catch these headings for now. Okay, so how many theories did you learn in this session? And try to answer or try to remember how many developmental stages was there in each theory. All right, so we have learned two theories. One was the theory of cognitive development, and the other was the theory of emotional development or personality development, and each had some stages. So just try to jog back your memory, maybe pause the video now and go back and just try to recapitulate, try to remember just the number of stages. Don't go into details right now, just try to remember the number of stages. So this will help you to form your schema in your mental process. Okay, so once your schema is formed, and when you go back and read these slides all over again, the new information that you'll get, you will probably put those new information into the schema which have already been formed, and it will be very easy to organize your schema, and when you need the information back, it's very easy to open that schema and take out the information. So okay, so this is a good exercise. So I'm just trying to make you develop that schema for now, and then later you can add in more information and accommodate more information and assimilate more information, and then get some equilibration. And if you will not get equilibration, then you come and ask me your doubts, and then I'll answer your doubts, and hopefully that will resolve your disequilibrium, and then your schemas will develop, or maybe you develop a new schema. All right, so the last question here is guess who. So you have figure A and figure B. All right, so I am going to ask you to pause the video and see if you can guess the person. Okay, so have you guessed who's in A? So in the A is, yes, A is Dr. Erik Erikson. And I'm going to end by not telling you who is in the picture B. I want you to go find out who is in the picture B, and when we start the Google Classroom, I want you to post your answers there, and let's see who gets the answer right. So this, I'm going to leave this session untied for you to think over it, ponder over it, who is in the picture B. The hint is that he has something to do with development of theories of psychology, and one of the theories that you learn in child psychology. So with that, I end this presentation, and in the next presentation we're going to look at the third and the concluding part of child psychology, and where from we will pick up with behavior management techniques, and it will be easy for you to understand once you have learned the theories of child psychology and the different stages. All right, so this is it from me for now, and I hope you all have a great day. Till the next time, take care of yourself. Bye bye.